Here on the Inspirational Health House, we hope to give you inspiration along with health and wellness tips. This can be your go-to motivation hub for nutrition and healthy lifestyle living. We're all about health and wellness. Maybe you will find that motivation you need here on the Inspirational Health House. Welcome to our YouTube video on anxiety disorders. Anxiety is a normal emotion that everyone experiences at some point in their lives. However, for people with anxiety disorders, these feelings can become overwhelming and affect their daily life. In this video, we'll explore the different types of anxiety disorders and the treatments available. We'll also share some helpful tips for managing anxiety, including relaxation techniques and coping strategies. If you or someone you know is struggling with anxiety, this video is a great resource to learn more about this common condition and how to seek help. So sit back, relax, and join us as we delve into the world of anxiety disorders. What is anxiety disorder? Anxiety disorder is a type of mental health condition characterized by excessive and persistent feelings of fear, worry, and apprehension about future events or situations. It is a common condition that affects millions of people worldwide, and if left untreated, it can significantly impact a person's quality of life. There are several types of anxiety disorders, including generalized anxiety disorder, social anxiety disorder, panic disorder, and specific phobias. Each type of anxiety disorder has its own specific symptoms, but all of them share the common theme of excessive and persistent anxiety. Symptoms of anxiety disorders can range from mild to severe and may include physical symptoms, such as rapid heart rate, sweating, trembling, and shortness of breath. Emotional symptoms may include constant worry or fear, irritability, and difficulty concentrating. Anxiety disorders are caused by a complex interplay of factors, including genetics, brain chemistry, and life experiences. People who have a family history of anxiety disorders or who have experienced traumatic events are at a higher risk of developing anxiety disorders. While it is normal to feel anxious or worried from time to time, anxiety disorders are different in that the anxiety is excessive, persistent, and interferes with daily activities. Left untreated, anxiety disorders can lead to depression, substance abuse, and even suicidal thoughts. Fortunately, anxiety disorders are treatable, and there are several effective treatments available, including psychotherapy, medications, and relaxation techniques. Cognitive behavioral therapy is a type of psychotherapy that is particularly effective for treating anxiety disorders. It involves identifying negative thought patterns and behaviors that contribute to anxiety, and replacing them with more positive and constructive ones. In conclusion, anxiety disorder is a common mental health condition that can significantly impact a person's quality of life. It is caused by a complex interplay of factors, and symptoms can range from mild to severe. While anxiety disorders are treatable, it is important to seek professional help from a mental health provider. If you or someone you know is struggling with anxiety, with the right treatment, it is possible to manage anxiety and improve overall mental health. Let's discuss types of anxiety disorders. Number 1. Generalized anxiety disorder. Do you ever feel like you're constantly worrying about everyday things? Do you find yourself feeling anxious for no apparent reason? If so, you may be experiencing generalized anxiety disorder, a common yet often misunderstood mental health condition. Generalized anxiety disorder, or GAD for short, is a condition in which a person experiences excessive and persistent anxiety and worry about a variety of things, such as work, health, or family. These worries can be difficult to control and can interfere with daily life, making it hard to focus on work or enjoy social activities. One of the most challenging aspects of GAD is that the worries are often about normal, everyday things that most people don't find concerning. For someone with GAD, however, the worries can feel overwhelming and all-consuming. It's like having a constant voice in your head telling you that something bad is going to happen. But here's the good news: GAD is treatable. With the help of a mental health professional, you can learn strategies to manage your anxiety and regain control of your life. Therapy, medication, or a combination of both may be used to help you overcome GAD. Number 2. Panic disorder. Panic disorder is a type of anxiety disorder in which a person experiences unexpected and recurring panic attacks. Panic attacks are episodes of intense fear and discomfort that typically reach their peak within a few minutes, and can include symptoms such as rapid heartbeat, sweating, trembling, shortness of breath, chest pain, nausea, and a feeling of being out of control or in danger. People with panic disorder often worry about having additional panic attacks and may avoid situations or activities that they believe may trigger an attack. This can lead to significant disruptions in a person's daily life and functioning. The exact cause of panic disorder is not known, but it is believed to be a combination of genetic, environmental, and psychological factors. Panic disorder can be treated with medication, psychotherapy, or a combination of both. It's important for anyone experiencing symptoms of panic disorder to seek professional help from a mental health provider. Number 3. Social anxiety disorder. Social anxiety disorder, also known as social phobia, is a mental health condition characterized by intense fear, anxiety, or self-consciousness in social situations. People with SAD may fear judgment or embarrassment, leading them to avoid social situations or endure them with intense distress. SAD can manifest in a variety of situations, including public speaking, dating, meeting new people, attending social events, or using public restrooms. The fear and anxiety associated with SAD can be so intense that it can interfere with daily activities, relationships, and job performance. Some common symptoms of SAD include persistent fear of social situations, excessive worry about being judged or embarrassed, avoidance of social situations or enduring them with intense distress, physical symptoms such as trembling, sweating, blushing, or nausea, difficulty speaking or making eye contact, fear of using public restrooms or eating in public. SAD is a treatable condition, and several treatment options are available, including cognitive behavioral therapy, medications, and exposure therapy. If you suspect you may have SAD, it's important to seek professional help from a mental health provider who can provide an accurate diagnosis and effective treatment plan. Number 4. Specific phobias. Specific phobias are a type of anxiety disorder characterized by an intense and irrational fear of a specific object, situation, or activity. The fear is excessive and unreasonable, and it interferes with the person's daily life. Common specific phobias include fear of heights, flying, spiders, snakes, needles, enclosed spaces, and social situations. The fear can be so severe that the person goes to great lengths to avoid the object or situation that triggers it. For example, someone with a fear of flying may avoid traveling by airplane, even if it means missing important events or opportunities. Specific phobias can develop at any age, but they often begin in childhood or adolescence. The causes of specific phobias are not fully understood, but they may be related to genetics, environmental factors, or a traumatic experience. Number 5. Obsessive-compulsive disorder. Obsessive-compulsive disorder is a mental health condition that is characterized by recurring, unwanted, and intrusive thoughts, images, or impulses that cause anxiety, as well as repetitive behaviors or mental acts that are performed in an effort to neutralize the anxiety. Obsessions can take many forms, including fear of contamination, fear of harming oneself or others, fear of making mistakes, or fear of losing control. Compulsions can also take many forms, including excessive hand washing or cleaning, checking behaviors, counting, repeating words or phrases silently, or arranging objects in a particular way. These obsessions and compulsions can interfere with a person's daily life, making it difficult to work, study, or socialize. The compulsions provide temporary relief from the anxiety caused by the obsessions, but the relief is short-lived, and the cycle of obsessions and compulsions continues. Now let's discuss the treatments available for anxiety disorder. There are several treatments available for anxiety disorders, and the most effective approach depends on the specific type and severity of the disorder. Here are some common treatments. Psychotherapy. This is also known as talk therapy and involves working with a mental health professional to identify and change negative thought patterns and behaviors that contribute to anxiety. Medications. Antidepressants, anti-anxiety medications, and beta blockers are commonly used to treat anxiety disorders. They work by altering the balance of certain chemicals in the brain that contribute to anxiety. Cognitive behavioral therapy. This is a type of psychotherapy that focuses on changing negative thought patterns and behaviors associated with anxiety. CBT can be done individually or in a group setting. Relaxation techniques. This includes techniques such as deep breathing, progressive muscle relaxation, and meditation. These techniques help to reduce physical tension and promote relaxation, which can reduce anxiety symptoms. Lifestyle changes. This includes adopting healthy habits such as regular exercise, getting enough sleep, and eating a balanced diet. These lifestyle changes can help to reduce stress and improve overall mental health. It's important to note that a combination of treatments is often the most effective approach for treating anxiety disorders. If you or someone you know is struggling with anxiety, it's important to seek professional help from a mental health provider. Thank you for watching this video about anxiety disorder. If you or someone you know is struggling with anxiety, it's important to know that you're not alone. Anxiety disorders are a common mental health condition affecting millions of people worldwide. Various factors, such as genetics, environmental factors, and life experiences can trigger them. If you think you may be experiencing anxiety, we encourage you to reach out to a mental health professional for support. They can help you develop coping strategies and provide you with tools to manage your symptoms. Remember, it's okay to ask for help. Don't let anxiety control your life. With the proper treatment and support, you can overcome this challenge and live a happy, healthy life. Thank you for watching, and please don't forget to subscribe to our channel for more informative videos about mental health and well-being.